You mentioned you were here for a workshop. Tell me about that workshop with health practitioners.
I raised some definitions. I've been starting to raise those questions about what are we really talking about, because I think that's worthy of discussion. But beyond that, I move into reasons people struggle to understand health information. And I very much like to talk about many reasons that people struggle. Yes, literacy, someone who is challenged to read as a new or emerging or a struggling reader almost certainly will have trouble with health information because so much is written or in numbers or needs those basic literacy skills. But there are other reasons people can struggle to understand. And the other reasons I talk about include age. As people age, not only do literacy levels decline, but also we might have more chronic conditions, more medications, and life. We also talk about disability, as people have diminished abilities to see and hear and remember. We have less way for information to come in and to communicate it out. I talk about language, our word choice that we use, as we are all becoming a more multicultural and multilinguistic nations. What is that like for someone who comes from another language and land? I also talk about culture, somebody else's worldviews and their values and traditions and how they understand Western medicine. And I also talk about the role of emotion, what it's like to be scared, sick, overwhelmed, naked, wearing only a hospital Johnny. I know when that is me or my loved one, for at least a little while, information just doesn't sink in. So I do focus on those 6 reasons people struggle to understand. And the reason I spend so much time on those is because I really want to convey the message that health literacy is not about them, it's about all of us. It's a great factor of being human. We can all struggle to understand. That's where I start my time in the workshop. From there, we moved into 8 overall ways and best practices to communicate more clearly. And that's, people can find themselves in those strategies. And then from there, for NALA, we went into very specific strategies, and I worked with Jenny Lynch to be planning what are just the right ones that we want people to know. And we spent the most time on visuals and graphics and how they can help reinforce the health message.
Helen, can you tell me what is helping to move health literacy forward in the US?
Well, I just want to put this into perspective. The first time I heard about health literacy was an article that I read in the Journal of the American Medical Association 15 years ago. And it said in there that half or more than half of the adults in the United States have trouble understanding printed information. I looked at my population, went, yup. And then I thought, what am I going to do about it? And that started my journey. Well, I was one of the people you might consider an early adopter. When I would say to my colleagues, and I was working in a hospital then as an occupational therapist, I would say to other people, what are we going to do about health literacy? And they'd say, health what? Is that like teaching people to read? And I'd say, no, it's so much more than that. That was 15 years ago. Fast forward to now, here I am in Dublin talking about health literacy. Health literacy has moved from an issue in the clinic to an issue nationwide to getting worldwide attention. Whether it's our accreditation agencies, whether it is our policy, our national policy, our hospital accreditation, groups everywhere are looking to make understandable health information a routine part of what we do. And that has happened in 15 years with a number of people coming together from many perspectives: researchers, policymakers, practitioners, advocates, literacy programs, public health. We are all coming together on this to try to figure out the solutions.
You mentioned earlier how you became interested in health literacy yourself. Can you give me a little bit of your own history in the healthcare setting?
My background is I'm an occupational therapist, and I always worked in psychiatry, usually on inpatient psychiatric units. And I also have a master's degree in education. So wherever I worked, I was always at the intersection of health and education. And when I heard about health literacy, and I told you my first awareness, my aha moment was reading that there was a problem, but I looked at my patient population and I needed no more convincing. One research article was just fine with me. But I was in a position of influence as a department manager. I wanted to make things better. And there was no roadmap out there for what to do. And there's something about health literacy that struck my passion the way nothing else in my career has ever struck my passion. And I since left my clinical job soon thereafter, and I have focused solely on health literacy ever since, trying to figure out what we can be doing. I feel that my contribution to the field are practical how-to solutions, because I know what it's like to work every day in the clinic. I know what it's like not to have any more time or money. So I feel that's my contribution, are practical how-to solutions. And I write about it, I podcast about it, and I even have a book about it, Health Literacy from A to Z, practical ways to communicate your health message. So that's the part that I'm doing in there. I've been doing this for 15 years. I consult on projects, I serve as a plain language writer and editor, and I have the treat to go speak in front of audiences just like I'm doing here, or speak to the media about health literacy and help amplify that message.
And you have a website as well called healthliteracy.com. Tell me a bit about that.
I have 3 websites. I am open to every way we can to communicate. And my primary website is healthliteracy.com. And in there is information on my work and my background, but there's also a lot of access to resources. For about 10 years, I was a columnist for a magazine published by the Boston Globe. This was a specialty publication for allied health professionals, nurses and therapists and social workers. And my column was called In Other Words, and it was always about health communication and patient education. Over the course of 10 years, I wrote, maybe 100 articles. On my website, healthliteracy.com, you can access all those articles. Another website I have, and I'm very excited about this, is Health Literacy Out Loud. For over 2 years now, I've had my own podcast series, of which I interview others in the know about health literacy. So you can listen in on those conversations, and they're all free, as all the articles are free, and people can do their own learning about health literacy. And the third site I have is healthliteracymonth.org. About 12 years ago, I was still frustrated. People didn't know what health literacy was, and they sure didn't want to fix any problems. They didn't want to spend any efforts fixing a problem they didn't know they had. Health Literacy Month is an awareness-raising campaign to raise awareness about the problems. It's a low-budget operation that has turned into a colossal worldwide event. So in October, it's really the thrust is that groups everywhere and in their own way raise awareness about health literacy. So those 3 websites, healthliteracy.com, healthliteracy.com, healthliteracyoutloud.com, and healthliteracymonth.org.
Your own definition of health literacy is shared responsibility of literacy between patients and practitioners. Is that a good summary?
It's a shared responsibility, but even more than that, the outcome, the goal, is mutual understanding. So yes, we all bear some responsibility. The professionals bear more of it. Legally and professionally, they do bear more of it. I'm not putting it off on patients that they need to, that it's all about what they don't do. Not at all. It's about doing it together. But the outcome, the goal, to me, health literacy happens when we truly understand one another.
Helen Osborne, thank you. And here's to communicating simply and clearly.
Thank you very much. What a delight.